The NOT program is an ideal smoking cessation program for youth for a number of reasons. The first is that the program utilizes former smokers as leaders. As former smokers, these individuals understand what challenges the youth are facing in terms of addiction and pressure to continue smoking. Also, because most adults who smoke started in their youth, these leaders can relate to the teens in the program on why they began smoking in the first place. Another reason this program is ideal to implement for youth is because the program not only focuses on why they should stop smoking, but it teaches effective strategies for managing stress in ways other than reaching for a cigarette. Skills developed included self-control and stimulus control, dealing with social pressure, managing withdrawal, dealing with life stress in general, preventing relapse, and social skills. The program teaches to use stress management techniques like yoga and meditation. These skills are that will benefit the teens throughout their life. The most important reason the NOT program is an ideal smoking cessation program for youth is because it is cost effective. The overall cost to implement this program within the schools of a city, county, state, or nation are minimal. In today's day and age, everything comes down to cost. Programs, supplies, activities, jobs. Everything costs money, but only those things that benefits exceed cost are implemented. In the case of the NOT program, much of the cost to run the program is already taken care of by utilizing staff already employed by the school and implementing the program during hours the staff is being paid to be there. The cost of supplies is minimal because it only requires copies of some educational material. The greatest cost incurred by the program is during the initial setup to train the educators. Once there are trained NOT program leaders, there are minimal costs for implementation for the rest of the program. The NOT program is a cost-effective way to promote smoking cessation for the youth. With all of these factors taken into account, the NOT program is the ideal smoking cessation program for youth. The NOT program is a successful youth smoking cessation program for a number of reasons. The first is that it appeals to the stress youth face from peers, social life, family life, school, and even work. These are all significant sources of stress in a teen's life, and this program addresses these stressors and how to effectively manage them. The program not only explains how to reduce stress for teens, but also teaches them stress management techniques like yoga, meditation, and deep breathing. This program is also successful with teens because all of the leaders are former smokers themselves. The leaders are able to relate to the teens and how smoking is perceived to them. This allows teens to relate and listen to their leaders because they have been where the teens are today. Lastly, this program is cost effective. This means that schools, which receive limited budget funding as it is, do not have to put forth a large sum of money to support the program. The largest cost is the initial cost to train the group leaders. Once this cost has been taken care of, subsequent programs can run with minimal cost, mostly requiring incentives and educational material. Short-term effects of the NOT program include the cessation of smoking or reduction in smoking daily, the ultimate goal of the program. Another short-term effect for the youth is that they learn techniques that will help them manage their daily stress they experience in other ways than smoking. Yet another short-term effect is the reduction of harmful side effects that smoking causes. Quitting results in an increase in quality and quantity of life back to non-smoker levels. The long-term effects of the NOT program are numerous. One such effect for successful participants is increased life expectancy and a decrease in chronic smoking-related diseases and complications. This not only leads to an increased quantity of life, but also an increased quality of life. They decrease their chances of smoking-related illness and complications like COPD, pneumonia, and smoking-related cancer and resulting chemotherapy. Another long-term effect is the money that a former smoker will save or have to budget elsewhere instead of purchasing cigarettes. With the average cost of a pack of cigarettes at $5.51, one pack per day smokers can save on average $38.57 per week. To put that into perspective, a one pack per day smoker who continued to smoke for 20 years could save $40,223. A negative long-term effect of a successful smoking cessation program could be reduced sales for tobacco companies. Another long-term effect could be that individuals who were not successful at quitting with the aid of the program could internalize this failure and continue to smoke indefinitely, fearing that they are incurable or unable to quit. This program, as initially developed, is ideal for urban and suburban environments. Rural areas like Kentucky, West Virginia, North Carolina, and Mississippi face different challenges within the youth. The basis behind the NOT program, though, is its ability to be modified for the audience. Youth in rural Appalachian states experiences challenges unique to the area. Many of their families work on tobacco farms or for tobacco companies. Their survival depends on the marketing and sales of tobacco. Tobacco use is also seen as normal in these areas. The NOT program faces a unique challenge when implementing the program in these areas. It needs to stress the harmful effects of smoking on the body, both short and long term, while not diminishing the job their parents have and that their livelihood depends on. There is also a lack in access to medical service, like smoking cessation programs in these areas. The NOT program has the capability of being a widely disseminated program because of its low cost, which will help reach the youth in these rural areas.